Hi guys, this is Dr. Shamima Sattar from the YouTube channel Dr. Help. Today's August 15th and we are going to talk about a common skin condition, acne. Acne is very common. About 90% people at some part of their life will have acne. So it's not a surprise that many people requested me to make a video on acne. So here it goes. Before we can understand how to treat acne, we need to understand how it forms. It has 4 cellular levels. How? Think about it. When does acne occur? It occurs around age of puberty, nearing about menopause. What happens around this time? For some unlucky people, it can happen any time of their life, like me. Okay? So, why does it happen? During these times, there is an increase in androgen level, some hormonal imbalance that can cause increased oil secretion in our skin. When that happens, all the skin debris, our skin cells turns over almost every 6 days. So when that happens, they break off, right? But when there's increased oil secretion, they become more adhesive. So when they become more adhesive, they clog up our pores. And when that happens, guess what? All the skin cell debris and the bacteria, that is the normal flora in our face, becomes trapped inside those pores, and they proliferate and cause infection. And what happens when infection happens? Our whole body immunologic system comes and attacks it and causes inflammation. So those are the 4 stages how acne is formed. Increased oil production, increased cell stickiness, clogged pores, and lastly, mycobacterial proliferation and inflammation. So all the skincare products that works against acne is directed against all these 4 stages of acne formation. So if you understand that, you will know why it works. So what are the products that we can use for acne prevention? We want to use, first of all, we need to wash our face. How often should we wash our face? About 2 times a day. And what are we going to wash it with? Gentle soap that is fragrance free, and we want to do it about twice a day. We can use cleanser that has salicylic acid, benzoyl peroxide, or azelaic acid. How long do we want to put it on our skin? We can wash it, keep it around 5 minutes, and then wash it off. We also want to use something called retinol. We can use adapalene. We can use any kind of vitamin A derivative, tretinoin. Those are things that can help to help acne prevention. How? They decrease inflammation. They cause new cell generation. They decrease pore plugging. All those things, and above all, they also cause anti-aging. So all these are pluses. So we can use that ingredient for long-term use. We can use it at night. We can wash our face off, and then we can apply the retinol and keep it overnight. Remember, if you are using any product that has benzoyl peroxide in it, you have to remember that it has bleach. It can bleach your clothes, the pillow cover, your towel. So you want to make sure you're not using your most expensive clothing or towels when you're using that product. So be careful. Don't say I didn't warn you. And use the retinol at night. So if you do that, you are using 2 different products to help. The benzoyl peroxide is to clean up, and the retinol to do the rest of all the ingredients, all the good benefits that I just mentioned. So if you do that, that will be excellent. So guess what? Before I made this video, I went around my house trying to find skincare product. Guess how many I found? Look at that. Look at that. Do we really need all this skincare product? Do we need a lot of budget for our skincare? No, we don't. If you can take care of yourself with 1 or 2 products, you don't need much. So use one of them. Benzoyl peroxide, salicylic acid, or azelaic acid. Remember, azelaic acid is the only one that you can use for and during pregnancy for acne. Any other azelaic acid, anything else other than azelaic acid, you cannot use. So do not use benzoyl peroxide salicylic acid during pregnancy. Also, what else should you avoid? You should avoid alcohol-based products, like things that has astringent. It's very rough on your skin, cause a lot of cell turnover, and that is not good for us. So you want to avoid astringent. You also want to avoid alcohol and hydrogen peroxide. These are no for acne treatment. All right. So what else can you use for it? For acne, you can also use tea tree oil. Yes, you can do that. You can use adapalene. There's also a Epiduo that has adapalene as well as benzoyl peroxide in a mix. That's the only stable product that is in combination that is found in the market. I'm going to put a picture, so don't worry about it. You can take a picture of the stuff that you want to use and you should be fine. Don't worry, you don't have to memorize anything. At the end of the video, I will put all those pictures again for you just to take a picture, and you can just keep it there for reference. How long should you do these? 2 to 3 months. Yes, I'm sorry. Nothing happens overnight. Remember, good things happen to people who work hard. So consistency is very, very important. You cannot do it for 1 or 2 days and say, okay, nothing's happening, so I'm going to stop. Don't do that. You need to be consistent and continue your regimen. The ones you choose, stick to it and do it for 2 to 3 months, and you will see a difference. And also, remember I said be consistent, right? Always be consistent. Also, wash your clothes. Remember, you go to sleep on the same pillow every day. So all the good stuff that you did on your face, you washed it, you used the retinol and everything, and you went back to the same pillowcase every night. What will happen? All the stuff that we secrete from our face, from our hair, our scalp, goes into our pillow cover. So you want to make sure you're washing your pillow cover, your bed sheets, and your towels regularly. If necessary, you may even have to do it every day or every other day. Either whatever is convenient for you, but make sure you're using clean towels, bedsheet, and pillow covers. All right. When you wash your face, make sure you dab with a clean towel and take that extra moisturizer off, because that's the background for microbial bacterial proliferation. So you want to, when you buy a moisturizer, make sure it's water-based and it's not oil-based. When you use makeup, make sure you don't have greasy, thick makeup. If you do that, you're going to clog up your pores again and cause more acne. What else can I tell you? We already talked about bedsheet, consistency, alcohol-based product to avoid. Another very important thing, do not do spot treatment. What is spot treatment? That means you have 1 or 2 acne here and there. So then you are doing the benzoyl peroxide, you're using the retinol. No, don't do that. You want to take care of all the area that forms acne. For some people, it's on the cheeks. For some people, it's near your cheekbone. So you want to see where it is, and those areas you want to treat that whole area with the benzoyl peroxide and retinol. So don't do just spot treatment wherever it's coming, because we want to prevent new acne formation. So don't let new ones form. When they are formed, then you can also just attack that area, but you also want to make sure you treat your whole face. All right. Finally, there are a few medications that can also cause acne, so keep it in mind. Progesterone-based oral contraceptives, phenytoin, and steroid. So these are the things that if they cause acne, please talk to your doctor. Make sure that you have an alternative plan, and that's something you should come up with your doctor. Finally, if you have hormonal acne, that means acne that's happening in this area, it's usually due to hormonal imbalance. When you have that, please talk to your doctor too, because you may have an underlying condition called polycystic ovarian disease, or you may have cyst in your ovary, or even tumor in the ovary. Those are some other things. Even if you see symptoms like hirsutism, like male area hair formation, so like your beard area or the back of the neck, you have some extra pigmentation, things that are male distribution hair formation. If you see those, please make sure you talk to your doctor. Make sure you do workup, that there's no underlying condition that you need, and you may need special treatment for those hormonal acne. There is a new medication that came out. It's called Winlevi, and that one is also very exciting. We are hoping we can use that for the hormonal treatment of acne, but it's just been approved, so we still have to find out what happens when we actually work on it. All right. There is also a sunscreen that has that may have all combinations, and that one you can use that has zinc oxide, salicylic acid, all those combination. If they're used together for sunscreen, you can also use that. All right. I'm trying to think if there's anything else I missed. If I did miss anything, please don't hesitate to ask me. Leave a comment, leave a question in the comments so I can address that. I'm so sorry I missed you for 3 weeks. Summer has been so busy with so many things that has to be done, and my kids are always home away from school, so yes, mom's work is increased. So I am so sorry, and I apologize for not making a video for 3 weeks. I hope to see you next week, and you take care. If you like this video, don't forget to like and subscribe. If you don't like it, please leave a comment and let me know why so I can address it. And until next time, thank you for joining me. We'll see you soon. Love you. Take care. Bye-bye.